Dear friends, in this video, we are going to discuss dear friends, in this video, we are going to discuss some of the important spotters in lower limb. Actually, this is the third part in lower limb spotters discussion. Actually, also the last part. Okay, last part of lower limb discussion. Okay, so let's move to the first question. So, can you tell me which part of the lower limb you are seeing here? Yes, this is the back of leg, isn't it? Back of leg. So at the back of leg, one particular muscle is pinned here. Any idea? So what is the what is the structure pinned here? Yes, gastrocnemius muscle. Okay, gastrocnemius muscle is pinned here. Okay, and the subcosine may be attachments, nerve supply, or action. Okay, anything may be a subcosine. Okay, and as you see here, the gastrocnemius muscle consists of two heads. One is medial head of gastrocnemius, another one is lateral head of gastrocnemius. Fine. Okay. So coming to the next Spartans question, here the gastrocnemius muscle has been cut and reflected. Okay, so that you are able to see one muscle is pinned just deep to the gastrocnemius. Any idea about the muscle pinned here? Exactly, soleus muscle. Okay, the muscle pinned here is soleus muscle. Okay, here also we have to take care of attachments, nerve supply, action of soleus. Sometimes peculiarity of the pinned structure, like that question may be asked. Okay, peculiarity of the pinned structure, like that question may be asked. Okay, so let's discuss the subcosines for the gastrocnemius muscle as well as soleus muscle. Okay, see this slide which shows the origin, okay, of gastrocnemius soleus, insertion, nerve supply, and action of both muscles. Okay, so the both these muscles, gastrocnemius soleus, they belong to superficial muscles of back of leg, otherwise called as flexor compartment of leg. Okay, so what are the sites of origin of the gastrocnemius soleus? The two heads of gastrocnemius, medial head arises from medial condyle of femur, lateral head arises from the lateral condyle of femur, corresponding condyles of femur. Okay, the two heads of gastrocnemius arise. Okay, what about soleus muscle? Soleus muscle arises from two sides. One is tibia, another one is fibula, both the leg bones. Okay, soleal line of tibia and posterior surface of fibula, upper part of posterior surface of fibula. Okay, insertion, nerve supply, action, these three are common for this gastrocnemius and soleus muscles. Okay, what about the insertion of gastrocnemius soleus? Actually, both unite to form one common tendon called as Achilles tendon, which is getting inserted into the posterior surface of the calcaneum bone. Okay, posterior surface of calcaneum bone. Fine. What about nerve supply? Tibial nerve. Okay, action, plantar flexion of ankle joint. Okay, plantar flexion, that is downward movement of ankle joint. Fine. Yes. And what about the peculiarity of the soleus muscle? Okay, I hope you will be knowing. Soleus muscle is also known as peripheral heart. Okay, very commonly asked MCQ question. Okay, soleus muscle is also known as peripheral heart. Okay, because it contains, the soleus muscle contains, okay, venous sinuses. It contains numerous small veins called as venous sinuses. Okay, so when this venous sinuses contract, okay, contraction of this venous sinuses, okay, results in compression, so that there is increased venous return to the heart, increased venous return to the heart. That is the reason, because of the pumping action of soleus muscle, this muscle is called as peripheral heart. Okay, that is the peculiarity of soleus muscle. Okay, fine. Now moving to the next subquestion, are you able to see? Again, you are seeing the back of leg only. We are seeing the back of leg only. Actually, one tendon is pinned here, isn't it? Can you please identify the? Can you please identify the? Can you please identify the pinned structure? Yes, the pinned structure is Achilles tendon. Okay, Achilles tendon or tendo Achilles, whatever. Okay, so the subcausing may be formation. Okay, or where it is getting inserted, or what is the action of the pinned structure. Okay, already we have studied the formation of Achilles tendon, right? When we talked about the insertion of gastrocnemius soleus. Okay, so how the Achilles tendon is formed? Yes, it is formed by the union of the two muscles. Okay, what are the two muscles? Gastrocnemius and soleus muscles. Okay, write it in full form. Gastrocnemius soleus muscles both unite to form the Achilles tendon. So where is the Achilles tendon getting inserted? Yes, it is getting inserted into the posterior surface. Okay, posterior surface of calcaneum bone. It is getting inserted into posterior surface of calcaneum bone. Okay, that is the reason this Achilles tendon is otherwise called as what? It is also called as tendocalcaneus. It is also called as tendocalcaneus. Okay, fine. What about the action? The action, it is formed by the gastrocnemius and soleus muscles. Okay, so what will be the action of tendocalcaneus or tendoachilles? Yes, it causes plantar flexion of ankle joint. Okay, it causes plantar flexion of ankle joint. Fine. Okay, let's move to the next question. See, sometimes the flexor retinaculum of ankle joint, okay, may be pinned. Okay, it may be pinned. In this diagram, this blue color structure is the flexor retinaculum of ankle joint. Okay, I don't have the spotter's specimen. Okay, for the flexor retinaculum. Okay, anyway, make sure if it is asked, you are answering correctly. Okay, the subcausing may be attachments of the pinned structure. Okay, so this structure will be pinned. Okay, in the exam, this spotter's exam, this structure may be pinned. Okay, flexor retinaculum of ankle joint. So they may ask the attachments. Okay, otherwise structures passing deep to the pinned structure. Okay, fine. So let's talk about the attachments and structures passing deep to the flexor retinaculum. So as you see here, the superior attachment of the flexor retinaculum is what? Medial malleolus of tibia bone. Okay, the inferior attachment of the flexor retinaculum is to the calcaneum bone. Okay, so I hope you are clear about the attachments of flexor retinaculum. Okay, now coming to the another subcausing, structures passing deep to the flexor retinaculum of ankle joint. Okay, when you move from medial to lateral, okay, the arrangement of structures passing deep to the flexor retinaculum from medial to lateral is, if you want, you can remember by this mnemonic. Okay, the doctors are not here. Okay, so T is representing tibialis posterior tendon. Then D, digitorum longus. Obviously, we are talking about flexor retinaculum. Okay, so obviously the tendon name is flexor digitorum longus. Okay, then we have artery and the nerve of this compartment, namely posterior tibial artery and the posterior tibial nerve, otherwise simply called as tibial nerve. Okay, and the lateral most structure passing deep to the flexor retinaculum is H. What is H? Hallucis longus, flexor hallucis longus. Okay, fine. So this is the arrangement of structures deep to the flexor retinaculum from medial to lateral. Okay, fine. Now moving to the next Spartans question. Any idea about the area you are seeing here? Yes, this is the front of leg. Okay, front of leg. So in the front of leg, are you able to see one tendon is pinned here? Okay, actually this is the medial side, this is the lateral side. Okay, in this specimen. So any idea about the tendon pinned here? Yes, the tendon pinned here is tibialis anterior tendon. Tibialis anterior tendon. Okay. So what can be the subcausants? Attachments. Okay. Attachments, nerve supply, action. Okay. So when you talk about the when you talk about the attachments of the tibialis anterior, Actually, this is the medial most muscle of the front of leg, otherwise called as extensor compartment of leg. Okay. In the front of leg, the medial most muscle is tibialis anterior. So origin is from the tibia bone. Okay, tibialis anterior. It is arising from tibia bone, from the lateral surface of the tibia, from the lateral surface of the shaft of tibia. Okay. What about the insertion? Yes, it is getting inserted into the first metatarsal bone, base of first metatarsal bone. Okay. And the nerve supply is by deep peroneal nerve. Deep peroneal nerve. Okay. What about the actions of tibialis anterior? Three actions are there. DIM, DIM. Okay. DIM, DIM. So D is representing dorsiflexion of ankle joint. Okay. Dorsiflexion means upward movement of ankle joint. Okay. Dorsiflexion of ankle joint. Okay. Then inversion of foot. Inversion of foot. That is, the sole of the foot will be facing medially. Medially. Okay. If you consider this one as my right foot, this is the medial movement of the sole of the foot, that is called as inversion, and it maintains the medial longitudinal arch of the foot. Okay, so dorsiflexion, inversion, and medial longitudinal arch maintenance, these are the three functions of actions of tibialis anterior. Okay, so see this diagram which shows the four muscles of the front of leg, that is extensor compartment of leg. So in this diagram, you will be knowing the medial side, lateral side. Okay. So what are the four muscles from medial to lateral here? Yes, tibialis anterior. Just lateral to the tibialis anterior, we have the extensor hallucis longus, EHL, extensor hallucis longus tendon. Then even laterally, you have the extensor digitorum longus tendon. Fine. Then the lateral most muscle in the front of leg is peroneus tertius. Peroneus tertius. Okay. Fine. Peroneus tertius. So just now I told the tibialis anterior origin from the lateral surface of the tibia bone, shaft of tibia. Insertion is into the base of first metatarsal bone. Base of first metatarsal bone. Okay. Then sometimes, please remember, the extensor hallucis longus or extensor digitorum longus may be pinned. May be pinned. Okay. So how will you identify? Yes. If you trace the extensor hallucis longus tendon, you can see it is moving into the great toe. That's why it is called as hallucis longus. Okay, because it is getting inserted into the distal phalanx of great toe. Okay, after arising from the fibula bone. Okay, after arising from the fibula bone. Okay, so except the tibialis anterior, we have studied, which arises from tibia, the remaining three muscles of this compartment, hallucis longus, digitorum longus, peroneus tertius, all arise from the fibula bone. Fibula bone. Okay, so just we will make it simple. Just remember, all arise from the medial surface of the shaft of fibula. Medial surface of fibula. What about the insertion? Hallucis longus is getting inserted into great toe, distal phalanx of great toe. What about digitorum longus? Yes, it will divide into four tendons, which will get inserted into the lateral four toes, as you see in this image. Okay. The extensor digitorum longus will divide into four tendons, which will get inserted into the lateral four toes. Okay. Peroneus tertius won't be asked, so you need not bother. Okay, fine. What about the nerve supply? What about the nerve supply of all these four muscles of this compartment? All are supplied by deep peroneal nerve. Deep peroneal nerve. Okay, fine. What about the actions? Already tibialis anterior muscle, the three actions we have studied. Okay. Dorsiflexion is a common action for all the four muscles. Okay. And what will be the specific action for extensor hallucis longus? Yes, it causes extension of great toe. What about digitorum longus? Yes, it causes extension of lateral four toes. Okay. And the peroneus tertius is located laterally, isn't it? So it causes eversion of foot. Tibialis anterior causes inversion. Peroneus tertius causes eversion of foot. Fine. So I hope we are clear about the attachments, okay, nerve supply and action of tibialis anterior. Okay, so tibialis anterior only here pinned, but as I told, already extensor hallucis longus, extensor digitorum longus may also be pinned. So you can, if you trace the extensor hallucis longus tendon, you can see the tendon is finally getting inserted into the great toe. Okay, and are able to see the extensor digitorum longus tendon is dividing into four tendons for the lateral four toes. Okay, for the lateral four toes. Okay, fine. And the lateral most muscle you will be able to see here is peroneus tertius. Fine. Yes. So all these four muscles, they have the common action of dorsiflexion of ankle joint. Fine. And now, can you please try to identify the nerve supply for the pinned area? That's the question for this spotter specimen. Okay. Identify the pinned area. What is the nerve supply? What is the, if the pinned area is asked, identify the pinned area. Obviously, what is the pinned area? It is the yes, it is the first web space, okay, which is between what? Great toe and the second toe. Between great toe and the second toe, we have the first web space. Okay. What is the nerve supply? What is the innervation or nerve supply of the pinned area? Yes, the skin of first web space, okay, is supplied by what? Which peroneal nerve? That is the very commonly asked MCQ question as well as Potter's question. Deep peroneal nerve. Okay, it is supplied by deep peroneal nerve. Okay, deep peroneal nerve. Fine. Okay, fine. So now see here, the cutaneous innervation of the dorsum of foot is important. Okay, so this is the area we have talked about. The skin of first web space is supplied by deep peroneal nerve. Okay, as you see in this diagram, okay, this diagram shows the cutaneous innervation of dorsum of foot. Okay, so what are the other nerves supplying the dorsum of foot? Yes, the main nerve, okay, the main nerve supplying the dorsum of the foot is what? Superficial peroneal nerve. The major part is supplied by superficial nerve. Which part of the dorsum of foot they supply? Yes, as you see here, remember the saphenous nerve supplies the skin of the medial border of the foot up to the ball of great toe. What about the sural nerve? Sural nerve supplies the skin of lateral border of foot, including lateral border of little toe, Fine. Yes, this is the spotter's question. The skin of first web space, otherwise you can say first interdigital cleft, is supplied by deep peroneal nerve. Okay, fine. Yes. Okay, fine. Sometimes, okay, sometimes the another possible spotter's question is this may be pinned. Okay, this structure may be pinned. So can you please identify the pinned structure here? Any idea? Are you able to see one thick fibrous band? Okay, located at the level of ankle joint, in front of ankle joint. So what is this one? This is the extensor retinaculum of ankle joint. Okay, extensor retinaculum of ankle joint. Fine. So for the extensor retinaculum of ankle joint, they may ask the attachments. Okay, attachments. Otherwise, structures passing deep to it. Okay, so let's move little faster. So actually, the peculiarity of extensor retinaculum is it consists of two parts. What are they? As you see in this diagram, superior extensor retinaculum, then inferior extensor retinaculum. Okay, superior extensor retinaculum is attached medially and laterally to the lower end of tibia and the lower end of fibula. It extends from the lower end of tibia to the lower end of fibula anteriorly. Okay, what about inferior extensor retinaculum? Yes, as you see here, it is Y-shaped. Okay, Y-shaped. Laterally, you have the stem of the Y, which is attached to the calcaneum bone. What about medially? Medially, it consists of two bands. Upper band is attached to the medial malleolus of tibia. Lower band fuses with the deep fascia of the sole. Fine? So attachments may be asked of the extensor retinaculum. Otherwise, structures passing deep to the extensor retinaculum of ankle joint. Okay. So again here also, if you remember in order from medial to lateral, the mnemonic is the Himalayas are not dry places. Okay. The Himalayas are not dry places. Okay. T is representing tibialis anterior tendon. Then Himalayas, hallucis longus, we are talking about extensor, isn't it? So extensor hallucis longus, then artery and the nerve of this compartment, anterior tibial artery and anterior tibial nerve. Okay. Anterior tibial nerve is also called as deep peroneal nerve. Okay. Then D for digitorum longus, extensor digitorum longus. P is peroneus tertius, the lateral most. Fine. So this is the arrangement of structures deep to the extensor retinaculum of ankle joint from medial to lateral. Okay. Yes. Now moving to the next Spartus question. Actually, in part one, lower limb spotters, this has been, we have discussed this question, femoral artery. Okay. This is the upper part of front of thigh. Femoral artery was labeled. Okay. So sometimes this structure may be pinned. Okay. This structure may be tied. Okay. So can you please try to identify the tied structure if it is asked? Yes, this is the femoral vein. Okay. That time itself I told femoral artery lies just lateral to the femoral vein. Okay. This diagram, this is the medial side, this is the lateral side. Okay. So sometimes femoral vein may be tied. Okay. So the tied structure is, okay, the tied structure is femoral vein. Okay. Femoral vein. Okay. Tied structure is femoral vein, and the subcosine may be formation and termination, otherwise tributaries, otherwise applied aspect. Okay. Applied aspect. Any of these three may be a subcosine for the femoral vein. Okay. So femoral vein is moving upwards, isn't it? So femoral vein, okay, it is the upward continuation of what? Femoral vein is the continuation of popliteal vein. Okay. Just opposite to the just opposite to the femoral artery. Okay. So where the femoral artery terminates, that is the beginning site of femoral vein. So it is the continuation of popliteal vein at the adductor hiatus. Okay. What about the termination? What about the termination? Yes, it continues. Okay. The femoral vein continues as external iliac vein. It continues as external iliac vein where beneath the inguinal ligament. Beneath the inguinal ligament, the femoral vein continues upwards as external iliac vein. Okay. Tributaries, the two main tributaries of femoral vein, one is great saphenous vein, another one is profunda femoris vein. Okay. Great saphenous vein and profunda femoris vein. These are the two main tributaries of femoral vein. Fine. Great saphenous vein and profunda femoris vein. Okay. Applied aspect. What is the applied importance of the femoral vein? Yes, the femoral vein is can be used for intravenous infusion. Okay. The femoral vein can be used for intravenous infusion. Okay. In infants and children, infusion. Okay. Infusion. So the femoral vein can be used for intravenous IV infusion. Intravenous infusion. Okay. In infants and the children. Okay. Not in adults. In adults, median cubital vein is used. So in infants and the children, the femoral vein can be used for what? Intravenous infusion. Okay. Or injection, whatever, in infants and children. Fine. So coming to the last spotters question. Actually, I don't have the spotters specimen I don't have, because majority of the times during the dissection, the long saphenous vein, okay, otherwise called as great saphenous vein, may get injured. So the entire extent of the long saphenous vein, most of the time in cadavers, it will be disturbed. Okay, but in your cadaver, in your college, in your cadaver, if you are able to see the entire extent of long saphenous vein, it can be kept in spotters. It can be kept in spotters. Okay, so let's discuss the possible subcosins for long saphenous vein. Okay, formation, termination, tributaries, and applied. Any one may be a subcosin for the long saphenous vein. Okay, so what about the formation of the long saphenous vein? Yes, at the dorsum of the foot, there is one arch called as dorsal venous arch of the foot. Okay, which will be having a medial end and a lateral end. So the medial end of the dorsal venous arch continues upwards as long saphenous vein. Okay, so long saphenous vein is the upward continuation of medial end of dorsal venous arch of the foot. Course is not important in spotters. Anyway, it runs in front of medial malleolus, along the medial side of leg, along the medial side of thigh. What about the termination? It finally terminates or drains into femoral vein within the femoral triangle. Okay, after piercing cribriform fascia, saphenous opening, piercing femoral sheath, it finally drains into femoral vein within the femoral triangle. Okay, then another subquestion is tributaries. Other than formation, termination, tributaries may be asked. Okay, so in the leg, it receives anterior leg vein and posterior arch vein. The main tributaries are mentioned here. Okay, just before piercing the cribriform fascia, it receives three tributaries. What are they? Superficial epigastric vein, superficial circumflex iliac vein, superficial external pudendal vein. After piercing the cribriform fascia, it receives one tributary, that is deep external pudendal vein. Okay. So this diagram is showing the entire length of the great saphenous vein. This is the site of origin. Then it is moving upwards, ascending along the medial side of thigh, medial side of leg, and medial side of thigh. Finally, it opens into the femoral triangle, it drains or terminates into the femoral vein. Okay, femoral vein. This is the site of origin. This is the site of termination of long saphenous vein. Okay, fine. And okay, this diagram is again showing the origin and termination of long saphenous vein. Okay, what about the applied importance of the long saphenous vein? So remember, for MCQ purpose, the long saphenous vein is closely related to saphenous nerve. It is closely related to saphenous nerve. Okay, and the applied aspect of the long saphenous vein, okay, what? Varicose veins. Okay, varicose veins. So varicose veins means what? Okay, so applied aspect, if you write varicose veins in spotters, it is enough. Abnormally dilated. Okay, abnormally dilated. Okay, superficial veins of superficial veins will be called as varicose veins. Abnormally dilated and tortuous superficial veins will be called as varicose veins. Okay, fine. It is usually common in people who are standing for a long time. Fine. Yes, that's the end of Spotters Part 3 session. Thank you all. Thank you.